Hi everyone. Today we're joined by Dr. Eddie Stenejhem, our infectious disease physician for Intermountain Healthcare. We're going to get our COVID-19 update from him today. Eddie, thank you so much for joining us.
Of course.
We know you just had your second baby. How are you doing with everything right now?
We're good. It's busy times for us, but we did welcome our son about a week and a half ago and had a week off to spend with the family. And mom is a rock star, and our little baby Ernie is doing well.
That's great to hear. Yeah. We really appreciate you being here right now. So, it was recently announced that the cases went up 14% from yesterday. Yesterday it was at 807. Today we're at 1,012 cases in Utah. And there was a talk about the group of people that it's impacting here in Utah. Can you kind of give us an update on what's going on with that?
Yeah, sure. Today we topped over 1,000 cases in Utah, like you said. We've tested over 20,000 people in Utah. Intermountain itself has done approximately 9,000 of those tests. Our test positivity rate of all the people being tested per day is still only about 5%. The good news is that 5% isn't increasing. It's been relatively consistent over the past week, and we're not seeing that rise. And so we expected approximately this kind of type of new cases today being reported. And it's actually encouraging that we're not seeing higher spread and higher number of cases like we were worried about.
That's great to hear. So along those lines, does it seem like we're flattening the curve? Can you give us any sort of update on how social distancing is actually working for us right now?
It's really hard to tell right now. We're very early in this phase of the epidemic here in Utah. What is encouraging is that the number of cases per day has remained relatively flat. Could that be because we're early in the epidemic and we just started mass testing? Potentially. Could that be an evidence that we're flattening the curve? That also could be the case as well. I think really the next 7, 10, 14 days are going to really be telling for us in terms of which direction Utah is going. When we look at the community, most people are abiding by social distancing. Most people are staying away from large gatherings, minimizing their impact in the community. And so there is a potential that we are seeing the early stages of flattening the curve. That being said, when we look at the people getting infected in our Utah data, the population that's ages 25 to 44 makes up the most of the patients getting infected. That is the most positive tests are in that age group. And that is probably the age group that is not abiding by social distancing like we'd expect. And so we really need to focus on those people in that age group to really get them to understand why we're doing this, because they are then transmitting the infection to people that are more vulnerable.
So what are some things that this age group is doing that we should rectify and stop them? Are people still going out? Should people be going out with people they don't live with? What is the best way for them to be social distancing right now to make sure they're not spreading it to other people?
We agree with Governor Herbert. Stay home, stay safe. We really need those people, all of us, especially those in that age group, to stay home. Find ways to engage with your social network in different ways. Zoom, FaceTime. Get involved with your community, but do that from your comforts of your home. That's really the main message we have to really all abide by, especially those in that younger age group.
Yeah, I think it's really important also to check in on your neighbors or your family, but make sure you're doing it virtually like you talked about. I think having a cadence of how often you do that. I know with my family, we're setting up a weekly call where we all get together, talk about our week and how we're doing, and it's been really helpful for us. So I think that's very important.
Yeah, I think so. And I think we're seeing more and more creative ways that people are getting engaged with their friends and family and checking in and really asking them how they're doing, and really trying to understand what's going on in their world and how you potentially could help, whether it be your family, your community friends, or even community retailers that you like to support. Checking in is incredibly important.
So we just got a question about how essential workers can potentially still, or not potentially, but be still involved with this whole concept of social distancing. You still have to go to work, but do you have any advice for those people that still have to go to work but need to still maintain this social distancing?
Yeah, I think it's something where they need to work with their employers to say, when I'm at work, how do I remain safe? How do I remain relatively socially distanced while I'm at work? And that's going to depend on whether or not you work at Home Depot or if you're in a restaurant industry doing curbside pickup. It's working with that employer to say, what are things we can incorporate into our workflow to make sure that we're decreasing that contact with the public and also with other people within the office. And holding meetings that are only attended by less than 5 to 10 people, maintaining at least 6 feet of distance between coworkers, all of those things would be good practices in addition to the hand hygiene, the cough etiquette, and making sure your workplace is clean.
So being aware of your surrounding is very important. And let's get back to the question about testing that we keep bringing up. We had a press conference earlier today where we talked about some new testing sites that we launched. Can you tell us about who should actually be getting tested and what those people need to be doing right now?
Right. We have launched 20 testing sites in the community all over the state of Utah with the sole focus of really increasing access to testing. We now have the capacity within Utah to test approximately 2,500 people per day, and we haven't met that capacity yet. And so people that have symptoms of COVID-19, cough, shortness of breath, fever, those are people that really should be considered for testing. And if you're in one of the vulnerable categories, those that are age greater than 65, any medical comorbidities, immunocompromised, et cetera, we definitely need to get you tested. And so if your health condition is deteriorating where you feel that you are getting worse, we need to get you in and get you tested. But if you have symptoms of COVID-19 and potentially you live in a big family with other folks that it's going to really impact how you interact with them, that's somebody we want to test as well. We don't want people that are completely asymptomatic to come to our testing centers. But if you have symptoms that are compatible with COVID-19, you certainly are eligible for a test, and we'd encourage that.
If you can't get tested, though, you don't qualify or you're asymptomatic, what are some suggestions for people to do to not treat, but maintain the symptoms themselves at home?
Right. So if you go and you get tested and you're waiting for results, or if you have mild symptoms that you think may be coronavirus, but you're not going to get testing, you have to act like you are positive. And that is something we have to stress. So if you have fever, cough, shortness of breath, symptoms of COVID-19, and you're not getting tested, we really need you to consider yourself as positive and make sure you home isolate, stay away from other people until your symptoms have resolved and you've had at least 7 days of symptoms, and really be cognizant of how you are living in your home with your family. And so if you are in a home with multiple members, it's best if you could isolate yourself to a bedroom, identify a bathroom you can use if you have more than 2 bathrooms in the home, really good hand hygiene, good cleaning of the counters, minimizing contact with towels and other cups, things that people share, and really minimizing that contact on your family.
And along that same line, you mentioned having to potentially self-isolate with family members. If they cannot put themselves in their own room or situation at their home, should their entire family also be self-isolating, or what's the procedures for that?
It's hard. If you have a larger home and you can self-isolate into a bedroom and identify a bathroom you can use, that is ideal. If you don't have a larger home and you are all living and you're sharing a bathroom and a bedroom, you really have to think about what is the risk to my family? Are they at high risk for severe complications? And if so, would you consider potentially moving to a safer environment or having them move to a safer environment? If you can't, it's maintaining that distance every day in that home, at least 6 feet of distance, especially if you're coughing and symptomatic, and really good hand hygiene and washing everything down at least once a day.
That's really great advice. Is there anything else you kind of want to tell us today? Any other updates that we should be aware of right now?
I think the biggest thing is that we are monitoring and tracking this epidemic aggressively. We may be seeing the initial signs of a successful community engagement in terms of social distancing and what that could do in terms of flattening the curve. Right now, as it stands, we have the capacity in our healthcare system, in our hospitals, and in our labs to be able to take care of patients that are positive for COVID-19. We have the capacity to care for those that are in the ICU. This is what we want to maintain. And the way we maintain this is by aggressive social distancing. So if we can continue doing what we're doing and maintain these levels, we're actually going to be in a good spot. But again, it's going to take us a little bit more time for us to really determine which way this epidemic is going.
We just got a few more questions come in from Facebook. One of them was that the CDC just came out about whether they're reconsidering letting people or suggesting people wear masks in public. Do you have a stance on that at all, about what you recommend for people with masks?
Yeah, we're working with the CDC and really trying to understand their recommendations for this. Our highest priority in terms of personal protective equipment, so masks, for example, and gloves and gowns, are for our healthcare providers. Our first priority is we need to make sure our healthcare providers are safe in taking care of these patients. If we can obtain an allocation of masks and we have enough for our healthcare providers and we're talking about community masking, I think then we can have that discussion. If you're symptomatic in their community, and so if you have a cough or cold or even an upper respiratory infection, a mask is a good idea because you're decreasing the amount of viruses that you're putting into the community. If you're asymptomatic, whether or not you should wear a mask in the community is still to be decided. If you're more comfortable with that, by all means, but at the same time, we want to make sure that we have mask inventory for our healthcare providers that need them most. So it's evolving, and we'll be updating the public as we go on that.
And another question we just got was, if you're a frontline provider working with COVID-19 patients potentially or in the hospitals, should you be following the same sort of, or what sort of guidelines should you follow when you go home to your family?
Right, and so we're identifying best practices for that. And so frontline caregivers that are seeing patients in the ED or the urgent care, many of them, from what we're hearing, is that they're providing and bringing a change of clothes before they go home. And so they'll change at work, put it in a bag, go home, perform good hand hygiene, and those clothes go immediately into the laundry and run on a normal cycle. We're also identifying people that are using scrubs in the hospital, changing out of scrubs, having them laundered by Intermountain, and then getting into regular clothes before they go home, and then really focusing on excellent hand hygiene. Some of the workers have elected to shower before they go home, and then obviously a new change of clothes. And so those are best practices we've seen across the system that many people are doing, and that seem to make sense.
Should they be social distancing from their other family members as well, or?
At this point, we're not making that recommendation. Frontline caregivers can certainly go home and interact with their family. If they have had high-risk exposures, they'll work with employee health and infection prevention to assess those risks and whether or not they should self-isolate from their family. But if they're following our appropriate PPE or personal protective equipment policies, at this point we don't think that they need to be socially isolating from their family when they go home, as long as they're maintaining good hand hygiene and monitoring for symptoms themselves.
Great. Well, thank you so much for joining us today, Eddie. If you or someone you know has mild to moderate COVID-19 symptoms and would like to speak to a professional, you can go ahead and call our COVID-19 hotline at 844-442-5224, or you can use our symptom checker, which is located on our website at intermountainhealthcare.org, and it's in the bottom right-hand corner. Again, if you're having a medical emergency, COVID-19 or otherwise, it is important to make sure you get adequate care. Please still call 911 or visit the ER if you are needing medical attention. Thank you so much for joining us, and we'll talk to you guys next time.